Hello, everybody. I'm very grateful that I have the opportunity to present the data we obtained in the project, which is funded by your foundation. This project is on identification and implementation of a blood-based biomarker test for sporadic Creutzfeldt-Jakob disease in clinical practice. So what we are doing is we are looking for an easy-to-apply test which can be done in blood to diagnose sporadic Creutzfeldt-Jakob disease. This project is headed by Frank Lawrence, who used to be a collaborator in my laboratory, now moved to Barcelona again, which is a very nice city. I completely understand that he has done this. And me, and we are sharing the work and also the results with you. Okay, so the major aim of this project is, can we define a blood-based biomarker and can we implement this test in a clinical practice? We have some potential candidates which might be useful and might be detected in plasma or blood. And you see here the list of these potential candidates. So we have neurofilament light chain, which is a protein which is secreted by the neurons and is detectable in blood. It has been established for various neurodegenerative or neurological diseases, but it's probably also very useful for Creutzfeldt-Jakob disease. Then there's a protein tau, GFIP, and some other proteins are listed here. So there are some candidates which can be potentially applied as a biomarker in plasma, and we need to know how sensitive are these tests and how specific are they. I will talk mainly about neurofilament light chain, and which is the first one. I have 2 slides about tau protein in blood, and I have only one on GFIP, which will be shown at the end. I will not cover the other proteins because first it's too early, and second we don't have so much time to do this. The requirements for an ideal test which will be used in medicine are: the test should be stable, so it should not be changed by any conditions like when you are taking blood that already some of the parameters are changing. It should be reproducible, which means that when you measure the same sample 2 times, 3 times, 4 times, or if you measure it in different laboratories, you get the same results. It should be sensitive, which means that this test should show that there is the disease at preferably at very early stages. It should be specific, which means that it is not positive, the test is not positive in other conditions. It should be quantifiable, which means that we should get some quantitative numbers, which means that we can monitor disease progression with this test. And of course, it should be easy to use. It should be applicable in any laboratory in the world. So to start with the neurofilaments, NFL, in our laboratory, we used to analyze the preconditions, as I told you before. So first, we tested the stability of this test using cerebrospinal fluid and plasma. And we tested this at room temperature, which is shown on the left side. We tested neurofilament concentrations at +4 degrees, and we tested also the stability after freezing and thawing cycles, because sometimes we get the sample which was kept in the fridge or it was frozen, and we also need to know if the results are still valid. And what you can see from this slide is that NFL is very stable in cerebrospinal fluid, which is shown on the upper part of the slide, and also in plasma, which is shown in the lower part of the slide. So we always get almost same results independently on what we are doing with the sample. We freeze them, we keep them for 10 days at room temperature, and many other things. And you see that these conditions do not influence the test. So the next slide shows you the inter-assay and intra-assay variation of neurofilaments in plasma. What we have done here, we took 17 samples from patients and we tested in 2 different test assays, which means we tested the samples 2 times. And we tested the samples 2 times on the same plate. And what you see here is we get almost same results. So there is no big difference, no significant variation in these intra-assay measurements. Now to the results, because it seems for us that the test is quite stable and a good test. Now we tested neurofilaments in cerebrospinal fluid, in neurological controls, and in patients with Creutzfeldt-Jakob disease. And what you see here on this screen is that NFL in CJD is significantly high compared to both healthy controls, these are the controls in the middle, and neurological controls, which means patients with different neurological diseases. So those controls are a little bit higher than healthy individuals, but when you compare to CJD patients, then there is a huge difference and the results are very significant. So we see that there's a very strong upregulation of this biomarker in the cerebrospinal fluid. Then we were very optimistic and we moved to plasma, to blood. And because we did not know which is better to analyze, plasma or serum, we tested both. And what we have seen here is that you see on the left side, you see plasma levels from CJD patients and healthy individuals. And on the right side, you see serum levels from patients and healthy individuals. And they are also increased in CJD patients and markedly increased. This is not just a gray zone. It's really a high increase in both. But it seems to us that the results are a little bit better for plasma than for serum. So therefore, we proceeded with plasma further on. This is the next slide shows you the rock curve analysis of plasma neurofilaments. It is just to demonstrate the sensitivity and specificity of this parameter. This is a laboratory calculation which shows that this is a very good biomarker in terms of both sensitivity and specificity, because the area under the curve is very close to 1. It is 0.923 in plasma. And therefore, we can really be very optimistic that we have a good test here. So, and now I would like to share with you some data from a case report we had obtained during our studies. And this was a patient with coming from a family with fetal familial insomnia. And this patient came to us long time before he became symptomatic. He knew that he has a mutation. He was a mutation carrier, and he came for several years to us for examinations. He wanted to be, we tested him neuropsychologically and clinically. We did MRI, and we also took blood, or he donated blood on several occasions. You see on the right side of this figure, you see the plasma NFL levels from this patient. So when he came to us 3 years before onset, they were at normal range. This is 0.1 on this graph. 0.2 is 2 years before onset, 0.3 is 1 year before onset, and 0.4 was a clinical onset. But at that time, he had a very mild symptoms, and we still did not believe that this is onset of the disease, because he had a very mild sleep disturbances, and he had was also very depressed about that. But we could not find any evidence that the disease started already, but some weeks later on, it became clear that he is suffering from fetal familial insomnia. And what you can see from this graph is that we have a mild elevation of neurofilaments at this time point when he had subtle clinical symptoms, and the levels increased with disease progression. We have analyzed this for neurofilaments. Then later on, we also analyzed other biomarkers, which we can define, or we can analyze in cerebrospinal fluid, in plasma. And this was tau, YKL40, S100B, GFIP, and this is shown on the left side. So what you can see, all these markers are not indicative for any pathology, so they stay normal with time, but only the neurofilaments were increased in this time points, which shows us that this might be a potential test which is positive very early in blood. And of course, we explored this further. We took samples from our cohort from patients with fetal familial insomnia. This is, of course, now this cross-sectional part, and compared with healthy controls. And you can see that these levels are highly elevated in plasma in patients, but these are symptomatic, clearly symptomatic patients. Okay, then we also have an animal model. In our laboratory, we have plasma samples from animals, from mice, which are infected with different strains of sporadic Creutzfeldt-Jakob disease. These are TG340 PNP129MM mice, which are infected with M1 strain, and VV mice, which are infected with VV2 strain. And we collected plasma from these mice at different time points. And what you can see here, that these plasma levels, they are increasing at the time when these animals become symptomatic, which is, again, shows us that there is a clear correlation with of this marker with disease start and disease progression. Apparently, this marker is not pathological or in the preclinical stage, but it seems that we have here something which starts very early in the disease. Okay, then I move to a second parameter just to show you the 2 slides on that, which is plasma total tau in sporadic Creutzfeldt-Jakob disease. This has been done in some studies already, and what we have analyzed here also is that we analyzed total tau in sporadic Creutzfeldt-Jakob disease in plasma, and what we can see also here in the middle of the screen is that the levels are clearly elevated in Creutzfeldt-Jakob disease, but not in other neurodegenerative conditions or other dementia types. So this is another potential biomarker for sporadic Creutzfeldt-Jakob disease. We analyzed this marker here for in our mouse model, as I presented you, for neurofilaments, and it also seems that here we have an increase of the levels of tau during disease progression, and it seems that the increase starts with the clinical symptomatic phase. So now my last slide, just to show where we are moving on. GFIP is another biomarker which is in discussion for Creutzfeldt-Jakob disease, and here we obtain very interesting results for cerebrospinal fluid. But here what you see on this slide is on the left are CJD patients, healthy controls and neurological controls, and levels are down in CJD patients in CSF. So this is somehow an opposite biomarker than neurofilaments, tau, and other what we know today. Normally, we are looking for increased levels of some biomarker. Here have one biomarker which goes down. And of course, we need to understand this and to analyze further, because we also want to know if by combination of some biomarkers we can also obtain much more precise diagnosis of the disease. Yeah, with this I would like to thank you for your attention, also for the possibility to perform this work, which we are doing and which is supported by the foundation. And of course, this work was not done by myself alone, but by many, many people who were involved in my laboratory in Göttingen. On the left side, the second from the left is Frank Lorenz at that time when he was in Göttingen. And on the right side is a PhD student, Seski Kanaslan, who performed all the tests. And I would like to give special thanks to her and to Frank for this work. And yeah, that's it, what I wanted to present. And I will be very happy to answer questions. Thank you very much.